Okay, Alpastat versus PStat strategy in CPB. During open heart surgery, we often cool the patient's body to protect the brain and organs. But here is the tricky part. Cooling changes how blood gases behave. So perfusionists use two strategies to manage this, Alpastat and PStat. First, Alpastat strategy. In this method, blood gases are always measured at 37 degrees Celsius, no matter what the patient's actual temperature is. And we don't add extra CO2 during cooling. So the advantage here, the natural autoregulation of blood flow in the brain is preserved. This means the brain controls its own circulation better. That's why the Alpastat is usually preferred in adults and standard CPB strategy. Okay, now PStat strategy. In this method, blood gases are corrected for the patient's actual temperature. If the patient is cooled, CO2 is added to maintain normal pH at that temperature. This increases cerebral blood flow and improves oxygen delivery to the brain during deep hypothermia. Because CO2 is potent cerebral vasodilator. That's why PStat is commonly used in pediatric surgeries and deep hypothermic circulatory arrest. So overall, Alpastat maintains enzyme function and cerebral autoregulation best for adults, and PStat increases brain perfusion during deep cooling, best for children and when brain protection is critical. So the choice between Alpastat and PStat isn't random. It's important decision by the perfusionist for the patient's age, type of surgery, and depth of hypothermia.